Let's talk to Carol, who's in New York. How you doing, Carol?
Hi, Dr. Hoffman. Nice to talk to you today.
My pleasure.
Doctor, about 7 years ago, I was diagnosed with osteoporosis, and from listening to you, I went on the strontium, and it reversed it, definitely.
Excellent.
And
this is like strontium testimonial hour here. This is great.
Yes. My doctor was shocked. She didn't believe it, that it could happen, but it did. And I continued on for a few years. Excuse me. And then I decided to go off it because I was getting very good scores.
Yes.
However, they have kind of now went a little higher, and I'm not too happy. So I was going to go back on it, but I am now on Coumadin.
Yes.
Sorry to say, and I read an article saying that it could thicken your blood. Now, do you think it would?
No, I don't think it thickens the blood, but and it's not contraindicated when you're on Coumadin. But what's the reason you're on Coumadin?
For AFib.
For AFib. Okay, so here's the thing. Probably the safest thing you could be doing is if you take strontium, which may have a slight blood thickening effect in people who are very prone to blood clots. Say you've had DVTs, deep vein thrombosis, or if you have a pulmonary embolus or something like that. Maybe you shouldn't take strontium. But if you're taking Coumadin, that's like, really a powerful blood thinner, and would counteract any kind of slight blood thickening effect that strontium might have. And I'm not even sure that American versions of strontium have this effect. We've seen it in Europe where they use a different type of strontium. So I would say perfectly safe for you. Unfortunately, one of the things that helps bone that you can't take is additional doses of vitamin K. I mean,
I take it, doctor.
So that's interesting. You've started on the Coumadin and you're taking the vitamin K?
Yes, I told my other doctor, not my cardiologist, the other doctor told me, you keep taking that, Carol, because I was thrilled taking that. He said, let them work around it.
Exactly. That's very good. And that's very good. Yes. That is correct, actually, because what happens is vitamin K will antagonize Coumadin. It won't obliterate it. It will somewhat reduce its blood thinning effects so that you have thicker blood or a lower INR. That's the ProTime that your doctor measures from time to time when you're on Coumadin to monitor its effect. But that's great when you have doctors on board cooperating and saying, okay, you take a little bit of vitamin K because you know its health benefits. It has anti-heart disease benefits and it has bone-enhancing effects. Take a little bit of it. We'll use maybe a little bit more Coumadin to counteract the effects of the vitamin K. And as long as you keep taking the same dose day in and day out, you'll be fine. This is also in the past where they said, don't eat any green leafy vegetables, avoid, all these healthy foods. Well, great, your Coumadin's going to work, but you might get cancer because you're not eating healthy greens. Yeah. So no, you're absolutely on the right track. You're an astute listener. Your health literacy is way up there. And so we're going to keep boosting it throughout 2016 on your behalf. So keep listening and keep reading our articles at drhoffman.com, and you can't go wrong.
Oh, no, thank you, Doctor. I listen to you all the time, and I want to wish you a very happy New Year. And I'm just so happy you're on the radio because I have learned a lot.
Well, thank you very much. And don't forget the podcast, because the podcasts, we have 5 additional days of content available free to you if you go on the Internet and download the podcasts at drhoffman.com. So please keep listening.